This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. We're right here at 888-630-9625. That's 888-630-9625. Love to hear from you. Let's talk about things that are bugging you. This is the new year. Happy New Year, everybody. It's off to a running start, at least at the Roselle Center for Healing. We've got all kinds of things that are going to be taking place. We'll talk to you a little bit about that as the program goes on. But we have a topic today, one that I think is appropriate starting off the new year. When I put it on the schedule, my staff looked at me and said, really? Why would we do that? Because it hits kind of all of us at one point or another. What are we talking about? Well, let me give you a definition and see if you can figure it out. It's primary in many situations. It's a chronic disease of brain reward, motivation, memory and related circuitry. Dysfunction in these circuits can lead to classic biological, psychological, social, and even spiritual manifestations. It's reflected in individual pathologically pursuing reward and or relief substances and how they are affecting them. What are we talking about? I can go on and on. We're talking about addictions. Addictions of any kind, no matter what it is, whether it's alcohol addiction, cigarette addiction, food addiction, behavior addiction, all of those things fall in the same category, and the thing of it is they all have the same underlying triggering mechanisms. Ultimately, when they become chronic, there's its own self-perpetuating feedback loop, and there is a way of breaking these things, whether it's alcohol or drugs or other things like that. And, we get started on little, I'm going to try this type of thing, I'm going to try this sort of situation, and we feed the beast. And the beast can be broken. And one of the ways that it can be broken is by using things that are drawn from Eastern medicine. And to talk to you about that, in studio, Dr. Stephanie Pina.
Good afternoon.
Yes, indeed. Happy New Year.
Happy New Year.
And it's going to be a great year. But, I picked this, and you kind of asked me, why are we doing this process? Because in our practice, we see, over the years, hundreds of thousands of patients. And unfortunately, the addictive process, it can be an addictive personality, a pattern, but it goes back to the same reward center in the body. It's a pain-pleasure type of syndrome that has a lot of biochemical characteristics. It has a lot of ingrained energetic characteristics. In Chinese medicine, it has to do with one thing supporting or nourishing the other, and we'll talk about that and touch about that in a second. But also the receptor site substitution for certain chemistries, if it's a chemical addiction, for things that should be naturally produced and made. And there are genetic predispositions to this. There are environmental triggers. There's all kinds of things. So that's what we're going to talk about today. And then this Wednesday evening, you are going to embrace this topic, and you're going to kind of tear it apart for anybody that would like to attend. And you should probably have a full house, because this is a process that, whether it's somebody that started out with Adderall as a kid or Ritalin, and now they're into cocaine, or they're into marijuana, or they're into whatever, or it's a food pattern addiction, or it's an emotional repetitive behavior addiction, alcohol, whatever, it's all the same processing, and generally the approach is the same. And I truly have never seen anything much more effective than acupuncture and counseling and nutrition together that can make an effect, but it has to be a process that's incorporated. There's a guy by the name of Dr. Jay Holder who was given a huge award and recognition for this years ago, and has tremendous results in doing this. And basically we do the same thing, but we're going to talk about that. So Dr. Pina, I'm going to let you run with this a little bit. Let's talk about, from your point of view, because you see it all the time, how does the addictive process manifest? Is it always blatant, or is it subtle?
Well, first of all, I think it's the perfect time of year to do this. So I wasn't surprised when all of a sudden it popped up and I was the lecture speaker for this one anyway. So
yeah, I trust you with this topic.
I think it's the perfect time because, we get addicted to the New Year idea anyway. So get things new, make a new fresh start. And, if you don't do it this month, you can wait till Chinese New Year next month. But, there's a perfect reason to get started on this stuff. So the addictive process by itself, it comes with highs and lows, literally. Because we want to find reward and happiness in our lives and in the things we do, but sometimes we can't do that. So it's easier to get locked into this idea that a certain substance, a certain, addictive personality, a certain type of OCD thing that we do can all kind of give us that high that we're looking for, and that's innately built into our survival instincts. We want to do what's best for us. We want to feel good. We don't want to feel bad. We run away from that. So when you come down to what the process does in the body is it really is a learned mechanism. We start with something easy, like you were saying, and then we might change or increase the substance because we're built that way. And the problem is when a lot of people try to go through, withdrawal, when they try different types of recovery effects, so much emphasis is on how do you change just the brain chemistry? How do you go in there and change the receptor sites so you can get off of one substance versus another? And very little of it is looking at that mind-body connection of why we got there in the beginning. And I think Chinese medicine, because they couldn't always pull out what was the chemical component of an herb or, of poppy seed or anything, but they had to figure out why is this person in the situation they are and how are they having an issue dealing with this? Why is it so tough?
Dr. Stephanie Pina is my guest in studio. Your host is Wednesday evening at the Roselle Center for Healing. This Wednesday, the 7th of the month already. Wow. You talk about things going by quickly. Anyway, 7:30. We'd love to have you as our guest. All you have to do is call 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. The addictive process, the addictive personality, they talk about that as well. But we're talking about biochemical triggers. We're talking about reward pleasure centers within the brain. We're talking about, and here's something that I want to ask you. There are very few people who start an addictive process that actually like the experience to begin with. For example, alcohol. Okay, how many people do you know that are at least not genetically predisposed that put their fingers in a shot glass of scotch or whiskey or bourbon or whatever, as a little kid and tasting and goes, yumbo, this is really good stuff, or a cigarette or anything like that, or even a drug. I mean, the kids that are out there using marijuana and other drugs, that stuff is not okay. I mean, it gets into their palate. I mean, it's the immediate reward situation, but to get it past the taste buds, to get it past, how do they do that? How does it overcome that? Somebody who starts smoking thinks it's cool. It's going to make them bigger and better, like everybody else, but that cigarette does not do good things the first time they put it in their mouth.
Well, I think we start realizing that those things that we don't like have an effect on the body. You do it a couple of times, whether it's peer pressure that gets you into it, but then you start to feel the reward system from it and say, hey, I remember what that was. It's becoming a learned process. Let me try a little bit more and a little bit more, and that leads from one thing to the other. There was actually a really interesting study that came out where they asked high schoolers who were either currently smokers or not smokers, and they asked them, do you think you're going to be smoking in 5 years? And 5% of them said no. And then they came back 5 years later and they asked the same people, and 75% of those that were already smoking were still smoking. So even at that level, when they're going, okay, I recognize I don't want to do something, within 5 years that's become part of their process. They kind of forgot about their initial response and just kind of kept on with it.
Well, we know that nicotine is as addictive as heroin, and it goes to the same receptor sites as heroin. And so when somebody, for somebody to quit, there has to be a huge pain motivator to say, I'm done, I'm finished, that's it, no more. But once you get into the cycle and you start substituting chemistries that are immediately gratifying in the system, where they should be balances of serotonin, GABA, and dopamine and so forth in a ratio that your own endorphins start rising when you want to trigger them, and that what we're looking here for is an endorphin rise. We're locked in. Let's pick one of these things and kind of take it apart. So everybody over the holidays ate too much, drank too much, and they're feeling sluggish, and they're saying, I'm going to work out, I'm going to change my diet, I'm going to do whatever, and, they do it for about 30 days, some of them 2 weeks, some of them they get into the gym once and sign up for the membership and they never go back again. So what's that process? Why is it that pain now so imbued into their physiology over the last 2-3 weeks. They get to the place and said, New Year's Eve, I'm done. I'm going to quit. I can't do this anymore. This is not okay. And they really mean it. Deep down in their heart, they mean it. But they're addicted, and they can't move away from it.
Well, I think a lot of it has to do with the fact that, they've got the mindset to begin with, but then there's that withdrawal effect. And whether it's food or alcohol or smoking or you name it, you can only go so long if you're ready for a process, you're ready for that reward system to kick in before you start feeling those negative effects. And even if it's coming off of sugar, you can get withdrawal effects, or say coffee and stuff. You're going to start to feel it within those 1 or 2 days, and it's not going to always make you feel good. You're going to go to the gym and you're going to get sore because you haven't been doing anything, so that doesn't feel good either. So why would you want to go back to doing that? We stop to lose focus on what that process is and where we want to go. So it's kind of changing your environment, changing your goals. So that mindset needs to change. It's not just about the brain chemistry. It has to be about changing and relearning a new, different lifestyle, new finding your new reward, basically.
So what happens to set the person up? What sets them up for the fact that they got to have the alcohol? We know that it's a receptor site problem. Somebody who's been drinking a long time, you got all these alcohol little receptors that are sitting there. And, genetically they're predisposed and pass through and so forth. And then that leads me to another problem I have with Alcoholics Anonymous or Drug Anonymous and so forth. Even once the chemistry and the habit and the lifestyle and so forth is changed, they still go to the psychological piece that person is always an alcoholic. Mm-hmm. For the rest of their lives, they're an alcoholic because that's the psychological piece. I don't buy that, but that's neither here nor there because I know behavior can be changed on the same model we're talking about right now.
Well, what's the interesting thing, and you see this in why certain recovery and rehab systems don't work, or they work to an extent, but they never quite do it for the person, even though they may be, sober or not have been using, is essentially there is that mental, emotional effect that goes, the idea of being an addict on anything is a very negative connotation, and when you can't break that out of your own spell, you're constantly having to reface that over and over and over again. So they always say time kind of helps, but essentially as soon as you start even to slip up and actually be human, you're going to have that negative connotation again, and no one wants to talk about being addicted to anything. That's when, they talk about that's one of the first steps is just coming forward and realizing that fact.
But are we talking about frontal lobe impairment here? Frontal lobe is what gives us the ability to discern right or wrong, or the capacity to understand that there are consequences to our actions and our activities. Ingrained enough that we make decisions. That's one of the reasons they send young men to war, is because they don't worry about being sent into battle. That frontal lobe can't tell them they're going to get your head blown off or your legs blown off or you're going to die. As you get older, you aren't willing to take the risk levels because you know that there's a consequence. So does addictive processes start early on and then manifest themselves later, or does it have something to do with that model?
It's a good question.
It is. I was hoping you shed some light on it.
It could go either way because it's a little bit of the chicken or the egg. Because you talk about the prefrontal lobe, which is kind of more the advanced brain and kind of the way we think and process and feel things, and then the addictive cycles. That reward system is part of our survival system, so that's part of our limbic system, which is the older part of us. So which one is driving which? When we start thinking about what we're doing, does that make that prefrontal lobe stronger than the survival process, or are we going to initially go back to it?
I don't know, but we're going to figure it out. 888-630-9625 this Wednesday evening, the 7th of the month, coming up. This Wednesday is the 7th already. 7:30 p.m., Dr. Stephanie Pina will be your presenter at the Roselle Center for Healing. She's going to be talking about addictive processes and what can be done, and the fact that you can break these patterns and cycles, but it takes a multi-directional approach to do that. We've had case after case that has responded extremely well. She is the expert in this area. Join us. Call us 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. I promise you that you're going to have an eye-opening experience. It's a night that could change your life. It could change the life of somebody that you love forever. We'll be right back after some very important messages.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, The Special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, The Special, showing at the Angelica Film Center Mosaic on Sunday, January 18th at 2 p.m. For tickets and information, visit agelesshealthmovie.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio talking about a fascinating and very, very addictive subject. It's called addiction. And one that Dr. Stephanie Pina, my guest in studio, your host this Wednesday evening at the Roselle Center for Healing, will be talking about in depth. We're talking about food addictions. We're talking about alcohol addiction, cigarette addiction, behavior addictions, and so forth. They're triggered by the same pleasure reward centers within the brain and the same chemistries that ultimately have to be controlled over a period of time. It's really a neurological, biochemical, emotional, spiritual problem that has to be addressed, if you will, multidimensionally. Before we get back into the program, I want to invite you to join me on Sunday the 18th at the Angelica Film Center in Merrifield, Virginia. It's at the Mosaic, which is this little town center, and what we're going to be doing is we're going to be showing the 2-time Emmy Award picture called Ageless Health. It was presented on PBS. PBS has just released it now for public viewing, and I will be there. I'm going to present the topic. I will remain afterwards and answer any and all of your questions. I'd love to meet you. Come and say hello to me. This is a fundraiser, by the way, for Caring for Others, LTD, an amazingly involved 501c3 charity. So it's $10 a ticket. If you go online at agelesshealth.com, you can get the tickets, or just go to our website, actually go to rosellecare.com and scroll down about two-thirds of the way down the page and sign up, and we'll be there. And I'll answer any and all your questions about what we do, how we do what we do. And it features 6 patients who had failed under traditional medical care, from a woman who has MS to a woman who was so allergic to different types of things that she would go into seizures and anaphylaxis, a young boy who was ADD, ADHD, off the roof, fireman whose back was going to ruin his career, couldn't get care anywhere, a woman who was a master's level tennis player, and so forth. This is a program that if you really want to see the intimacies and the interreactions and interrelationships of integrative and alternative therapeutics, don't miss this. It's the 18th of the month at the Angelica Film Center in Merrifield. I will be there. I'd love to make it so that, there's no question about how effective, how productive that this form of therapeutics are over traditional care. We're talking about addiction today, Dr. Pina. Let's get back onto the subject, because it's critical that people understand that they have a way out. Excuse me, that this is not something that they have to live with. That's something that they can actually get their hands around. How many times does a person quit drinking alcohol, or somebody that quits drinking or quits smoking, or stops eating sugars, or stops a behavior, tries to control it, only to fail and to go back to it a month or a year or whatever later on, because the mechanisms were never dealt with completely. Why is that?
Well, I think because there's that physical and there's the emotional mechanism. When you do reach that failure state, which, we're all human, we want to improve and learn and be able to master ourselves. But when we do that, it's that failure kicks back in, and boy, it felt good when we were back on that subject. And did it affect me at that time? No. We talk about this a lot when we try to change things up with nutrition. And we talk about how, one meal seems like nothing if you cheat on that one meal, but if you do it over and over and over again, that's where you start to feel the consequences of it. Well, the same thing can go with the addiction, is, on that in-between step where when you finally reach the point where you're going to make the decision to make a change, you're all motivated, but when it comes time for that addictive substance to start kicking back in, we're faced with this dilemma. What do you do? Where do you go?
And quitting hurts. I mean, the physical manifestation of stopping something, whether it's a biochemical addiction or whether it's a physical addiction, can cause an untold and unpredicted emotional and physical pain pattern. When you want to detox, there's something that we used to call the Hersheimer's reaction, which say that you revisit the same symptoms that you're trying to get rid of, and sometimes at a worse level, simply because the body can't handle the detoxification process, or you're doing it too quickly, or you're doing it without the chemistries, the enzymes that are necessary to blunt it. The same thing with any addictive process. The body has to be reset, if you will, and to get it to a normal psychological playing field is the hardest part. That's the challenge. That's getting that squared away. Fortunately, there's ways of making that happen as well. But this Wednesday evening, I know you're going to get into all the pieces of that puzzle. Let's talk a little bit about, that pleasure reward center that we talked about a little while ago. What makes it so profound? Why is it so dramatic in its addictive personality or addictive process in all these things we're talking about?
Well, like a lot of things, too, it definitely comes in cycles. So when, your withdrawal responses are high, or when you really have that craving, it's going to come back and forth. So when you start to get over something and you're like, okay, I can handle it, it starts to kick back in a little bit later. 2 or 3 hours later, you're looking for that substance, and you've learned that that's what feels good. You want to go for it. So I think when we see this, the other part is going, what is it really masking? What is that addiction really trying to cover? And the underlying issues of why we have those addictions and what it's covering. Maybe it's a trauma. Maybe it's something like PTSD. Maybe it's, self-worth and loneliness. That's really the issue that you have to also treat with any kind of addiction, because you can't just blame it just on the substance itself. You have to blame on the environment that's around it.
I was doing a little research on a topic that I'm going to be presenting at the end of the month, and I was doing a little bit on today's show as preparation, and I came across something that I didn't realize because I present it differently, that according to the U.S. Department of Health and Human Services, that addiction is the number one cause of death in the United States. So I said, how can addiction be the number one cause of death? Well, then you go through and you look at all the pieces that it triggers, from heart attack to coronary disease to stroke patterns to accidents. You accumulate that all into one area. And in fact, yes, when you look at it that way, the substance abuse that the patient has, or the behavioral abuse that the patient has, ultimately triggers these other things to occur at a much faster, much more alarming rate than in anything else. We're going to come back after some very important information. This Wednesday evening, Dr. Stephanie Pina will be your presenter at the Roselle Center for Healing. She's going to talk about addiction, but more importantly, what you can do about them and stop the addictive process. Whether you're a smoker, whether you eat too much, whether you're locked on a certain behavior characteristic, the fundamental preparations are the same in how you address them. Make sure you show up. 703-698-7117. Don't go away. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We've been talking about addictions, and we're going to talk a little bit about how we fix them, but more importantly, we want to handle your questions. So give us a call, 888-630-9625. If you'd like to talk to us outside the program, that's easily done. All you have to do is go to rosellecare.com. That's ROSELLECARE.com, and send us a note, and somebody will get back to you if you need to talk to us and not send us a note, well, you can do that simply by calling the number you're going to call to register for this Wednesday night's program at 703-698-7117. And just let us know that you want to talk to somebody, and we'll get it done. So this program's on addiction. If you have any questions, but if you have a problem, stopping cigarette smoking, you've tried 10 times and you keep going back to it, or you can't stop drinking alcohol, or you're hooked on that sweet tooth and you can't break that habit, there's ways of getting this done and doing it very, very effectively. And that's what we're talking about today. My guest in studio, Dr. Stephanie Pina. This is her area. We're going to talk a little bit about the approach in a minute, but more importantly, we'd like to talk about your problems as well. 888-630-9625. Let's talk a little bit about how we handle the process, because there's hope for people out there. I mean, they don't have to stumble along the rest of their lives, and feeling bad and having that negative feedback loop continue the process of reinforcement, if you will. I tried it, I failed, I tried it, and I failed, and I'm done. And, well, you didn't look far enough, and there's really a way of getting this done, and it's effective, it's immediate in many situations. It's not something that takes forever to begin to get a handle on. The emotional pieces are, something that have to be approached as well, but nevertheless, there's excellent results, and evidence has been supportive of this. Just as an anecdote, the first acupuncture detoxification and addictive center was opened in the United States in 1974 at the Lincoln Memorial Hospital in South Bronx of New York City. And it was a direct result of President Nixon opening up the doors to Asia and bringing the concept of Eastern medicine into this country. And we found that nothing else really has worked that effectively over time. So let's talk about the approach. How do you go about treating somebody that has an addictive process? Let's talk about something as straight up as chemistry first. That they've been hooked on cigarettes, or they've been hooked on drugs, or they're hooked on foods, because it's all chemical in nature.
Okay. Well, one of the things, too, that I like when I explain, and we're going to go into this details on, this Wednesday night as well, too, is the fact that when you look at addiction, it's similar to a lot of different chronic diseases, because you do have to deal with it over and over again, just like heart disease, diabetes, you name it. So when you look at some of the processes that you have to address that you wouldn't normally think of, you have to worry about what are the adrenal glands doing, that chronic stress. How do you change that? It's not just about the substance. And when you're changing up the brain chemistries too, you have to play a fine line between changing the brain chemistry to turn it on so that you have that motivation drive, but you don't want to overdo it as well too. Acupuncture is great in that aspect because it's there to balance the system out. So you're not trying to turn something off or turn something on. You want to use points that are going to balance the body out, and you can treat everyone individually, as well as using some of these time-tested protocols like what they did at the Lincoln Center as well, too, which is most people know it as the NADA protocol.
The National Institute of Health has been researching acupuncture in many different forms relative to chronic pain patterns, but also primarily in addictive patterns and how to stop this. What we know is that it stimulates the release of endorphins in the body. And it's that plain pleasure situation that we're dealing with, and this is why we give certain drugs. We give different opiate inhibitors and so forth without substituting, if you will, for what those drugs were trying to do. So subsequently, the person goes back to what it was that they were doing. The withdrawal is too tenuous, but you have a person that gets off of heroin and other drugs, and they're substituting with methadone. And methadone is a disastrously addictive drug, and they're taking one addictive drug and replacing it with another. Acupuncture resets the system. How does it do that?
Well, just like you're saying, it increases endorphin release, whether you're treating pain or you're treating withdrawal symptoms, which essentially is the same thing that the addictive substance is doing to begin with. So in one way, you're almost mimicking a little bit of what's going on to kind of ease that transition. The other thing that can do basically is you can improve not only energy rates, but you improve sleeping rates, which allows you to heal better at night. You can improve relaxation rates so that when the body starts to kind of look for that addictive quality, you don't have that same response anymore. It's like just when same people come in and treat, I want to get treated for stress because I'm too stressed out. Well, the problem is you can't change all the stressors. With addiction, you can start changing the actual product and stuff, but you need to change how your body responds to it. So you need to basically change up how the body responds to these symptoms, but then also that addictive process too, so that in time, the body doesn't need to go through all those withdrawal effects. It can actually handle the changes quicker.
888-630-9625. That's 888-630-9625. Love to talk to you on any subject. We're talking about addictions, food addictions, drug addictions, personality addictions, all those things that we're trapped in and can't seem to break the cycle with. Dr. Stephanie Pina is our guest in studio, your host, your presenter this Wednesday evening, the 7th of January at the Roselle Center for Healing, 7:30 p.m. Call us at 703-698-7117. That's 703-698-7117. And Dr. Pina will speak with you privately as well after the program and talk to you about your very specific situations. Dr. Pina, there's a lot of the research is saying that people are predisposed, if you will, genetically to certain types of addictions. And we've known that for a long time with alcohol. And we know that there are fetal syndromes that show up when the mother's been, not willing to clean her act up, so to speak, before pregnancy, whether it's drugs or with alcohol. And they talk of something called the A1 allele, in the genetic map that causes this problem. And it's actually in the receptor site for that reward pleasure center, and it has a lot to do with dopamine and the dopamine mechanism and response. And I know that the research has shown, which is very encouraging, that people who have gone under or gone through acupuncture treatment in conjunction with very, very specific nutritional substitutions and nutritional additives, meaning enzymes and so forth, have been extraordinarily successful in settling these things down. So essentially what you're doing is you're going after the hypothalamus centers of the body, and you're producing higher amounts of serotonin, or the feel-good juice, and which counteracts something called GABA. And GABA is the one that kind of gets you to go crazy and gets you to go out there and over the top and do repetitive patterns over and over and over again. So you got to have a balancing act. And this balancing act seems to be one that acupuncture has a profound impact.
Well, I think one of those things is as we go over and we get crazy with that and the GABA kind of increases and stuff too, the one thing that we want to do is it takes a physical toll on the body. We talk about how if your life is spent on just trying to get that next fix, you're going to forget everything else. So with the way acupuncture works is to kind of relax the body so that the normal body can function as well too. So that means that you're going to be able to absorb some of those nutrients that you're basically becoming malnutrition at. You're not bringing them in, you're using them up. Some of those nutrients like, magnesium, B vitamins, folic acid, those are essential for a lot of different processes outside of the brain, in the brain. But essentially what we need to do is kind of learn how to control not only the chemistry part, but also that mind-body part too, so that we don't give in to those driving.
It's an interesting process, because regardless of the initiating problem, some people get addicted to drugs because they're in chronic pain. So the only way that they can make it is that they have to take pain medication all the time. And we know that so many of the pain medications have not only side effects, but they also have addictive processes. So when you remove the drug from the body, the patient actually experiences more pain. And the same with illegal drugs, but these happen to be legal drugs. And when you deal with a patient like that, you have to be able to get those receptors to calm down, so to speak. And the more drugs that you use over time, the more receptor sites that you have. It's like the body says, "Oh boy, here we go. Let's get as much of it as we can." And now it becomes part of the normal physiology, the neurochemistry of that process. And so you have to deal with both of those. The process of neurochemical imbalance is one that if it's not dealt with straight up with a lot of our patients, I have patients that come in and they're on some heavy-duty narcotics because of the chronic pain patterns. But I know that we send them into the acupuncture department, often not to control the pain, but to control the chemistry, and that seems to make a huge difference. Why is that?
Well, I think one is because they start to realize they have a little bit more control over it when they can just allow their body to relax, because you can't directly mimic the same, how can I say this, the same amount of pain relief that medication can at a point, but as they're starting to feel better, as they're starting to heal and their systems start to come back on function, they can realize that they can have a handle over it without needing that substance, without needing those pain medications. And the other thing too is it's an emotional process as well too. So sometimes, and I've seen this plenty of times in the office, even a couple weeks ago we saw this, is when you're going through that addictive process, we don't want to see anyone's strengths and weaknesses. We don't want to show that you're in pain and stuff. And, the good things about acupuncture will bring that out of you. You have to include that emotional part of the triad of health in there too as well in the addictive process. And acupuncture kind of allows you to kind of start to balance that side of it that's not always just involved with the physical side.
There's several amino acids that I've used over the years with, trying to get people off of drugs, and it's the same that many of the addiction centers use with people who go in for alcohol. Tyrosine, glutamine, tryptamine. There's one called ethanolamine, which is specifically used for alcohol and the byproducts. What is noted, and which I found very, very fascinating in one of the research studies that I've done, is that you have to use these things, to get the patient to detoxify and to be able to blunt the conversion and to stop the craving. But people who have high levels of tyrosine in their body, people who have high levels of naturally formed glutamine and so forth, don't seem to have the addiction or the tendency to addiction or the inability to break the cycle, if you will. And so much of this is high levels of proteins. The body produces something called phenylalanine, as found in many high protein foods. It's that at Thanksgiving, you eat turkey and you want to go to sleep. It's actually not tryptophan, but it's phenylalanine that's doing that, and it quiets the system and it blunts the neurological pathways from overreacting, so to speak. They're found in things like chicken and turkey and fish and milk but raw milk, let me say that, and pumpkin seeds and sesame seeds and lima beans and avocados and so forth. That's probably why I don't have a huge addiction. I eat avocados every day and all kinds of protein. But that's those are the things that I found that were extremely fascinating when you actually start doing the background research on this and the why is that. Most mammals, meaning us, we synthesize tyrosine from phenylalanine, and so we need to have those foods in there. So without tyrosine, neurological pathways don't work. The addictive process becomes much more significant, and so these neurotransmitters, so to speak, are if those things aren't there, are problematic. If they are, then life becomes much more controllable, if you will. So when you evaluate a patient, they come to you. If they were coming in just for this type of process, what would you have to know, and how would the treatment vary? And I don't expect you to get into the peculiars of the specificities of treatment, but how would they vary based on the patient?
Well, of course, you want to know how long this has been going on for, get the basic background, what they've done in the past that's either worked for them, or what were the ideas around why it didn't work for them. What do they think's going on? I see a lot of kind of roadblocks with patients when they're not willing to give you that information, because you have to really learn through them, and that's why you can come up with an addictive, not really the process of it and the treatment for them, but you want to individualize it for them. You know that certain things are going to be good for withdrawing from certain types of symptoms, but you really have to sit down and focus on why they are where they are, what started the whole pattern. So sometimes you do have to get into some of the emotional background stuff that takes time for people to come forward with. You also want to see where they're feeling it. Physically, how do they feel? What have they done before? Where else are they noticing? Is it affecting their job? So when you start doing that, then you can start to realize how much of the gut you have to treat, how much nutrition do you have to treat, how much of changing the acupuncture protocols as they come in, and how often they need to come in to really get that support mechanism in place, because you don't want to start this process and just stop midway through it. A lot of times you see that happen with people who start on, for smoking, all the different smoking devices out there. They think, I'm just going to substitute one for the other and then I should be able to stop. And when they start to do that, it doesn't work out so well. They get too addicted because they're not addressing other things. They're just adjusting the chemistry. So you really want to come back where they're coming from not only a physical standpoint, but from an emotional one as well, too.
Tyrosine is an interesting amino acid. We have several people online that are waiting. I'm going to take them when we come back from the break, at least to take a couple of them. But this has been such a fascinating subject, I've wanted to talk about it as much as we possibly can. And to remind our listeners that this Wednesday evening, Dr. Stephanie Pina will present the subject of addiction and what to do about it and how to fix it. Join us at the Roselle Center for Healing in Fairfax at 703-698-7117. Tyrosine, as we spoke about, is an interesting amino acid because it converts or triggers the production of something called L-DOPA, and we deal with that with Parkinson's and repetitive neurological degradation. It's one that is missing in way too many of us, and it's needed to allow that neurological substance to balance itself. We have extreme deficiencies in a lot of things, including magnesium and B6 and tyrosine and vitamin D3 and so forth. A whole different subject area. But nevertheless, we've got to take a break. We'll come back after some very important messages. Don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio starting out the new year the right way, teaching you how to break those negative addiction patterns. Dr. Stephanie Pina has been my guest in studio, your host this Wednesday evening at the Roselle Center for Healing. Give us a call at 703-698-7117. Tell my staff that you'd like to attend. Our in-house programs are a gift to the community. There's absolutely no charge whatsoever. All we do require is a reservation because we only have limited space in our office, and we'll do the program twice, but we need to know that you're going to be there. But this is a program that encompasses so much in our lives, from the foods that we eat to the alcohol that we drink. If you're on psychotropic drugs, there's all kinds of stuff out there, like benzodiazepines and the MDAs, the indopans. These are euphorants, amphetamines, caffeine, cocaine, nicotine. They're stimulants, by the way. Depressants like alcohol, opioids, barbiturates, hallucinogenics, LSD, and things that will actually stimulate nitric oxide. All these things can be problematic to the body, and there is a whole bunch of interrelated, interactive things and hormone-related patterns and so forth. But you know what? Whether it's that or cigarette smoking or whatever else that you're into that you can't seem to stop, there's a way out. There's a way out of the rabbit hole. Give us a call at 703-698-7117 and tell my staff that you'd like to be present this Wednesday for Dr. Pina's presentation on addictive patterns. Shirley, thank you for being extremely present and patient. How can I help you?
Yes, I have DVT in my legs. They're pretty well discolored, and I take LASIK for the edema. But the other day I was just sitting quietly in my kitchen, and the front of my thigh, like in the middle, all of a sudden it felt like bee stings, and maybe even gurgling in that spot. I don't know, it was very strange, and I just wondered if that's indication of a blood clot.
It could be anything, Shirley. It's the fact that you have deep vein thrombosis. You can feel it. It's the experience that you're going to have symptomatically is going to be more painful than anything else. When you feel that other type of sensation, whether it's pins and needles or just some sharp burning pain or things of that nature, that often can be just neurological. That can be from the nerves that come from your low back that go to the legs, to the thigh muscles, to the calf muscles, to the hamstrings, and so forth. Look at a nerve that comes off your spine like a big coaxial cable. If you cut it, in half, you're going to see all these little fibers, and each one of those fibers has a very, very specific capacity or job in the body. And that gurgling can be muscle fasciculation. It could just be, a firing or misfiring of the muscle patterns. So when that occurs, it's just off the top, you can't tell, but the swelling that you have, the fact that you're taking Lasix to keep the swelling down. Lasix, unfortunately, will cause other problems because it takes potassium out of the body. And when you have potassium being taken out, your energy is going to go down, but also muscle cramping is going to be one of the things that you're going to experience. So that can be part of that. So,
I take potassium every single day.
But you may not be absorbing it, and unless you're getting somewhere between 750 to 1,000 milligrams, and that's just starting to. And then you have to look at what other things need to be balanced. Magnesium, potassium have to be in the right balance. If they're taking the sodium out completely, your body needs some sodium, not a lot, but it needs some to balance it out. So your whole trace mineral composition is being altered. Yeah. So there's a lot that needs to be done. But when you have edema, the swelling of the legs, you have to begin to encourage those lymphatic vessels to begin to move that out, and there's multiple ways of making that happen. But I don't think it's a DVT problem. It's not characterized that way. There's other things that are taking place that could be enhancing and making your DVD worse. So
that makes sense, because I didn't give too much thought to this, but I was coming down the steps and I slid on a magazine. I didn't know it was there. It was nighttime. And I went down the last 3 steps.
There's your answer, my friend. Okay.
It's
sure.
painful now, just for the second, at the bottom of my thigh.
That's what's causing it, hon. And before you get into worse shape, give us a call. Have it checked out, because it can just perpetuate itself with further problems as time goes on. This Wednesday evening, Dr. Stephanie Pina will be your presenter. Dr. Stephanie, give us a thumbnail in the next 40 seconds, 30 seconds of what the program's going to be about.
We're going to talk about the process of addiction and why we end up in the shape that we do. How does it affect the brain? How does it affect the rest of the body? How does it affect the organ systems that we don't usually think of? And when we're making those changes, as far as whether it be coming off of drugs or alcohol or cigarettes or changing our diet and getting the sugar out so we can lose weight, how is it that we have a hard time with it? What are the points that don't get addressed on an everyday basis? Why do we tend to go more towards recovery and failure of that? What's the mind-body connection? And how does things like acupuncture, herbs, nutrition, exercise, how do those help understand the processes that we go through?
This is an extremely fascinating area of interest, and one that can be very straightforward and dealt with successfully. Join us this Wednesday evening. We'll see you next week, same time, same old place. This is Dr. Tom Roselle. Bye. This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.